Hello everybody, welcome back to my channel. This is your favorite midwife Joy, and please, if you've not subscribed to my channel, please do so right now before you continue watching the video. Just subscribe, click on the notification bell, so whenever I post a new video you can be notified. Okay, so today our topic today is indication for caesarean section. Yeah, is a very important topic and very controversial as well. And the topic, what actually made me to discuss about this is that many women, we've lost so many of our mothers through this. We've lost, so many casualties, so many things has happened through this, what I'm about to talk about now. So that is why I take out my time to talk about this extensively. Okay, so if you are watching this video and you've not subscribed, please subscribe, share this video in case anybody in your Facebook or anywhere needs to see it. Share the video, subscribe, click on the notification bell so you can be notified whenever I post a new video. So what is caesarean section? I know if you're watching this video, I know it's no longer a new word or a new phrase to use. Caesarean section, that is a surgical operation done on the abdomen in order to bring out a baby, in order to deliver a baby from the womb of a pregnant woman. So who are the people that, like, who are the people that is not like it's a must that these people will have said, but who are the people that are likely? That's why we call it indication. Who are the people under this list? I mean, the people that can have caesarean section, the people that are likely to have caesarean section. That is what we mean by indications for CS. Who are the people in this category? Okay, so as a pregnant woman and you are getting pregnant for the first time, like this is your first child, this is the first baby you are carrying to 9 months, this is your first baby you are carrying to 10, this is the first time you are getting pregnant and you are carrying this baby to term, there is every indication that you might have a caesarean section. Number one is that this is your first time, number one, and this is your first time, your body is still adjusting. When something is happening to you for the first time, your body is still adjusting to some things, the hormones, the changes that pregnancy comes with, and your okay, I mean, your outlet where the baby will come out from is still tight, not yet exposed and all that. So, and you don't know the size of this baby. Like I said earlier, you've not pushed a baby before, you've not gotten pregnant before, this is your first time, so you don't know the size of the baby. And then your pelvis too also plays an important role in this case. So in this case, you are now in the hospital, and after some checkup and all that, your doctor tells you there is every possibility that you might have a caesarean section. Please, this is not the time to argue, because the most important thing there is for your life and your baby's life to be saved. Okay, so whatever the doctor tells you is for your life and your baby's life to be saved. Not as if the doctors gains anything, or the midwife or the nurses gains anything by subjecting a woman to caesarean section. No, if after all indications that you are on this category of people that will undergo caesarean section, please kindly accept that with your heart. Okay, then secondly is women that are less than 16 years old and women that are above 35 years. If you are less than 16 years old and you are getting pregnant, or you are above 35 years and are getting pregnant, there's every indication that you will have caesarean section. Because of what? Because of your age. 35 years and above, that is an elderly primate. You are 35 years and above and you're getting pregnant for the first time, that's an elderly primate. Then 16 years and below, that is too young for pregnancy, so there is an indication that you might have a caesarean section. Then we also have another one, which is height. Yes, height. If you are not too tall, if you're on the short side, there is nothing wrong with being tall, there's nothing wrong with being short. It's just for medical reasons. Like if you are less than 5.5 feet tall, like if you are less than 5.5, or your shoe size is 3, that is if you are using UK size 3, your shoe size. So just know that you might not be able to, the doctors might not even allow you to enter into labor in the first place because of your size. But if you decide to enter into labor, there is every indication that you might not push out that baby via through the vagina. There's every indication that you might have a caesarean birth. Then another people that are likely to have cesarean section is women with PIH, that is pregnancy induced hypertension. So if you have hypertension from 20 weeks, even before 20 weeks, that is superimposed hypertension or PIH, pregnancy induced hypertension, in any time during your pregnancy, there's an every indication that you are going to have a cesarean birth. In fact, as a matter of fact, there is a client or a patient I just cancelled like last month, that is few months back, and I told her uh, she's hypertensive. That's her fifth pregnancy, that's her fifth child, though the previous four she had them vaginally, but this particular one, with the fact that that's the fifth child, that she's a multiparous mother, and she's having hypertension, and age too, she's above 35 years. So I explained to her that this pregnancy, with everything surrounding this pregnancy, we wouldn't want you to get to 40 weeks. By 38 weeks you come, let's induce you because of your blood pressure. And one thing with induction is that if induction fails, the next available option is cesarean section. She said okay, fine, that she will go home, she will discuss with her husband, and she will discuss with her prophet, and she will get back to me and all that. I didn't see her again, not like after 1 month. I decided to call her, and she was telling me that I told her that she will give birth through operation. That is why she did not come to the hospital. I was like, oh my god. So everything I explained to this woman, the only thing she got from there is that I told her that she was going to give birth through operation, and that's why she didn't come to hospital. Funny enough, according to her, she said she gave birth at home, that contraction started. Her husband told her let them go to the hospital. She said no, that I told her that whenever she comes to the hospital we're going to do a cesarean section for her, and she gave birth at home. Glory be to God, she's fine, her baby is fine, there is no complication. But this experience is not generalized. That she escaped it doesn't mean that you too you can escape it. Okay, so every pregnancy comes with its own challenges, with its own with its own unique experiences. You cannot even judge the experience you had in the first pregnancy with the experience you are having in the second pregnancy, because they are two separate pregnancies and they come with their own unique features and experiences. So the next people that will also have is, they are likely to have a cesarean birth, is diabetic mothers. If you're diabetic mothers, they tend to have a bigger baby. So if you are diabetic or you're having gestational diabetes, there is every indication that you might have a cesarean birth. Okay, there's nothing wrong with having a cesarean birth. Okay, I know that we all are so, like, these Hebrew women of 18 have entered their heads. As a matter of fact, a Hebrew woman is a woman that is alive and her baby is alive, regardless of the method of the delivery. Yes. So a Hebrew woman is not just when you go into the labor room and push your baby out. That is not a Hebrew woman. A Hebrew woman is a woman that after giving birth, she's alive, her baby is alive, not just being alive, but alive and healthy. Okay, so another people that will have a cesarean birth is people that have had a cesarean birth before. Maybe during your first pregnancy you had a cesarean birth, and during the second pregnancy there is every chance that you also likely to have a cesarean birth. Then another people that will also have a cesarean birth is older women, especially the multiparous women, people that is up to 35 years and have given birth to multiple children, like 4, 5, 6 children. The uterus is, that's what we call uterine elasticity. It has reduced. There are lapses in the uterine muscle, so there's an indication that the uterine muscles might not relax, might not contract, not relax, might not contract after delivery. So that could lead to postpartum hemorrhage, and that could lead to death of the mother. So what am I trying to say? That cesarean section is not bad, is not bad at all. So whenever your doctor tells you that you might likely have a cesarean birth, yes, if you are, maybe you are having faith that if you're having faith, let your faith works for you. But the most important thing is to stick to your doctor's advice, because any advice that the doctor is giving you is for your own good, for your own good, for your own good, for your health, and for your baby's own good. Okay, it's not for any reason, and just for you to be fine and for you to be okay. There is nothing wrong with your section. So please, that is coming to the that will be the end of the lectures today. If you've not subscribed, please subscribe to my channel, share this video. Okay, share this video so that people on your contact list, your WhatsApp, your Facebook can see it. And please don't forget to subscribe. All right, bye bye, love you. I remain your favorite midwife. Bye 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 bye.